Hello, everyone. This is Alraies from RSH 2025. I'm really privileged to be with Alexandro Sticky to talk about new therapies for tricuspid valve uh, regurgitation. Dr. Sticky, thanks for being with us.
Thank you so much,
Yeah,
my friend, for the
yeah.
kind invitation. It is a pleasure of being here. It is really an amazing edition for the Riyadh Structural Conference. Thank you.
Thank you. As we know now, the tricuspid valve is getting more attention in recent years. It was before the neglected valve. Now it's becoming the center and front. So edge-to-edge repair is one option, but now we have new therapies. So let's go over some new innovative therapies that's in the market.
Yes, definitely. Tricuspid valve now is the field where you can find the hottest and the new technologies available on the cardiovascular field. We have the we have several number of prostheses, and now we are focused on orthotopic replacement, orthotopic replacement because it is the most natural way to replace the valve to have a solution about the tricuspid regurgitation. And TEER is a perfect solution, but in the majority of our patients it's not feasible because the gap is larger than what we can fix with a clip or a Pascal, and also the anatomy are definitely of dimension that we cannot treat with the repair. So
Yeah.
this is a true problem, and what we can do is to carefully assess the feasibility with the device we have that usually are smaller than what we need, and also we need to take care of the possible complications because the replacement is really an interesting field, but it is full of possible complications. We have pacemaker, we have bleeding, and also we have the afterload mismatch because if you change the regurgitation from massive torrential to zero in a patient that has right ventricle function that is not perfect, or pulmonary hypertension, this could be a problem for the patient. And
So let's talk about this briefly, just for the audience. As you said, the RV usually is dilated and
yeah,
has been failed for a while, and all of a sudden you take that regurgitation to zero, so you are changing the hemodynamic within
we
seconds.
change completely the hemodynamic, and this could be such a big issue for the patient. So
Yeah.
we find this solution with the Vidine valve to leave a pop-off hole, so a dedicated hole through the prosthesis, and in this way you can leave a mild regurgitation that is something calculated, computed, and this we find that is particularly favorable for our patient. This creates an advantage that allows you to have such a smooth passage from torrential to mild, and the patient have a fast recovery without losing significantly the reduction of the right ventricle. So it's
Perfect.
something very important that could be a game changer. And finally, you can close this hole whenever you want.
Yeah. Final comment about who will benefit from these valves and when you're going to be able to have it commercially.
Yes, now we are in the trial, the target trial, that will assess the efficacy and safety of the Vidine valve in a scenario of patients without this possibility of the pop fall. But we are thinking to this possibility in now collecting compassionate cases, and then probably we will go to something for a study dedicated to this setting of patients that of course are patients at very high risk, patient with pulmonary hypertension,
Yeah.
patient with a reduction of the right ventricle
Yeah.
function. So we need to take care of our patients in a personalized strategy, in a tailored way, and this is the only way to forward our technologies, or we will go one step forward and two back.
Yes. Well, again, very promising therapy. Again, as you said, for selective patients,
Yeah.
patient selection is important. but again, promising therapy. Thank you so much, Dr. Sticchi, for your
Thank
being
you
with
so
us.
much.
Yeah. Watch his videos and others on the YouTube channel and the website. This is Chadi Reyes coming to you from Riyadh Structural Heart Conference in 2025. Thank you again.
Thank you.